Nearly 20 countries have reported outbreaks of the viral disease with more than 100 confirmed or suspected infections. They include the United States, United Kingdom, Canada, Australia, and Israel. The viral disease has also been reported in Spain, Portugal, Sweden, France, Belgium, Germany, Italy, Switzerland, Austria, and Denmark. This is the first time these countries are reporting cases. However, in the past, the disease was restricted to forested parts of the west and central parts of Africa. According to the WHO, since January 2022, the Democratic Republic of Congo has seen more than 1,500 cases. Well, for more on this, the latest outbreak, we are joined by Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School. He joins us via Zoom from Bath, UK. Doctor, welcome to the program. Thank you for taking time out to speak to us. Now, with the world's attention now on this outbreak, which is spreading to other parts of the world, is there cause for concern?
I don't think this is a new pandemic or anything of that nature. We need to be very measured and careful. So what has happened is that there has been some persons who may have been infected from Central or West Africa, and then they have met many other people, perhaps in one setting, and then that infection has been dispersed to other parts of the world. We know a lot about monkeypox. We know how to manage it. Africa manages it all the time. And therefore, I don't think that we're dealing with a new situation like COVID. This is manageable, controllable, and I expect it to come and go.
All right, well, that sounds like good news. But now the Africa CDC is saying that several outbreaks of monkeypox in Africa were contained during the COVID-19 pandemic while the world's attention was elsewhere, which means the continent has the capacity to deal with the virus. To that, you say what, doctor?
So we expect these outbreaks, and as there is a reservoir for this virus, it is not surprising that sporadically in Central and West Africa, we get these outbreaks. But we know how to manage it. One thing may be interesting, which is for the last 40 years, we have not immunized against smallpox. So we obviously have a large, young population under 50 in Africa who are susceptible to monkeypox. And then when it is introduced into crowded, busy cities, which we didn't used to have 20, 30 years ago, with a very susceptible population, you generate a lot more cases than you used to do before. So it's not the virus that has changed, it is human behaviors and human things that we've done which have changed. And then of course we have international transport. So what happens in Nigeria or Congo can suddenly very quickly go to different parts of the world because of a lot of international travel.
All right, doctor, finally, to your point, the World Health Organization says there is no need for mass vaccinations. Are there any particular groups, though, or particular groups of people who will need to be vaccinated from your perspective?
So we know that the smallpox vaccine, which is the vaccinia virus, also provides cross immunity against monkeypox. So in certain situations where you are a close contact of a case, a confirmed case, you can be given the vaccine to protect and prevent that person from going on to develop that infection, especially if they are in the vulnerable group, immune suppressed, pregnant, that sort of thing. But general mass immunization globally is definitely not indicated. It wouldn't be a good use of valuable resources to go down that path with this outbreak.
All right, Dr. Bharat Pankhania, thank you so much for sharing your perspectives with us.